heart is the engine of your body, tirelessly working to pump blood, deliver oxygen, and keep you alive. But what if it was trying to warn you about an impending failure? The frightening truth is that heart disease is the leading cause of death worldwide, and in most cases, the body gives clear warning signs before a major cardiac event happens. The problem? Most people don't recognize these signals in time. Heart attacks and cardiac arrests rarely strike without warning. Your body often starts showing signs weeks or even months before the heart stops working. If you ignore them, you could be putting your life at serious risk. So stay till the end and learn the 7 warning signs your heart gives before it fails. If you experience any of these, consult a doctor immediately. And don't forget to subscribe to stay updated with crucial health information that could save lives. Number 7. Chest discomfort or pain. One of the most common warning signs of heart problems is chest pain or discomfort. Many believe a heart attack always comes with sudden, crushing chest pain, but in reality, it can start slowly and subtly. You may feel pressure, tightness, or a squeezing sensation in your chest. Some describe it as a feeling of heaviness, like something is pressing down on them. This pain can come and go and may not always feel severe. However, if you experience chest discomfort that lasts more than a few minutes or worsens with activity, it could indicate blocked arteries or an impending heart attack. If this happens, seek medical help immediately. Number 6. Shortness of breath. Feeling out of breath while doing normal activities like walking, climbing stairs, or even resting is a major red flag. Your heart and lungs work together to supply oxygen to your body. When the heart struggles to pump blood efficiently, oxygen levels drop, making it harder to breathe. Shortness of breath is a common symptom of heart failure and could indicate fluid buildup in the lungs due to a weak heart. If you find yourself gasping for air, even when you haven't done anything strenuous, don't ignore it. It could be your heart warning you of trouble ahead. Number 5. Extreme fatigue. Are you constantly feeling exhausted, even after a full night's sleep? Chronic fatigue, especially if it's sudden or unexplained, can be an early warning sign of heart disease. When the heart is not pumping enough oxygen-rich blood to the body, your energy levels drop, leaving you feeling weak and drained. Many people dismiss fatigue as a result of a busy schedule or aging, but heart-related fatigue feels different. It doesn't go away with rest and may come with other symptoms like dizziness, weakness, or an inability to complete simple tasks. If you are feeling tired all the time with no clear reason, your heart might be struggling. Number 4. Swelling in the legs, feet, or ankles. When your heart is weak, it can't circulate blood properly, leading to fluid buildup in your lower body. This causes swelling, particularly in the feet, ankles, and legs. The swelling, known as edema, happens because the heart isn't pumping efficiently, causing blood to back up in the veins. You might notice that your shoes feel tighter, your socks leave deep marks on your skin, or your legs feel unusually heavy. If the swelling worsens by the end of the day or is accompanied by shortness of breath, it could be a sign of heart failure. Seek medical attention immediately. Number 3. Dizziness and lightheadedness. Have you ever stood up and suddenly felt lightheaded or dizzy? Occasional dizziness isn't always a concern, but if it happens frequently, it could be a sign of poor blood circulation. When the heart struggles to pump blood efficiently, it leads to drops in blood pressure, which can cause dizziness, fainting, or even blackouts. If you often feel dizzy, especially when standing up or exerting yourself, do not ignore it. It could indicate heart rhythm problems, blocked arteries, or even an early warning of a stroke. Get it checked by a doctor as soon as possible. Number 2. Irregular or fast heartbeat. Your heart should beat in a steady, rhythmic pattern. However, if you notice your heart racing, skipping beats, or pounding unexpectedly, it could be a sign of atrial fibrillation, AFib, a condition that increases the risk of stroke and heart failure. Heart palpitations might feel like your heart is fluttering, beating too fast, or even stopping momentarily. Some cases are harmless, but if these irregular heartbeats occur frequently or last longer than a few seconds, they should not be ignored. A doctor can check if it's due to stress, caffeine, or a serious heart problem. Number 1. Pain or discomfort in other parts of the body. Many people assume that heart-related pain is only felt in the chest, but that's not always the case. Heart attack pain can spread to other areas, including the jaw, neck, back, arms, and even the stomach. Some people, especially women, experience pain in the left arm or upper back rather than chest pain. If you feel unexplained pain, numbness, or discomfort in these areas, especially if it happens along with shortness of breath, nausea, or sweating, it could be a sign of an impending heart attack. Never ignore pain that radiates or spreads. It could be a life-threatening warning sign. If you recognize any of these symptoms in yourself or a loved one, don't wait for them to get worse. Heart disease can progress silently, and by the time major symptoms appear, it might already be too late. Schedule a checkup with your doctor, get your heart health tested, and take necessary precautions. Lifestyle changes like eating heart-healthy foods, exercising regularly, managing stress, and quitting smoking can help protect your heart and reduce your risk. The most important thing is not to ignore your body's warning signs. Many heart attack survivors say they had symptoms days or even weeks before the attack, but didn't realize their significance. Early action can save your life. Your heart works tirelessly to keep you alive. Don't ignore the signals it's sending you. If you found this information helpful, share it with others so more people can recognize these warning signs and take action. Don't forget to subscribe for more valuable health insights. Stay safe, stay informed.